was just getting longer and longer to go to the toilet.
Inevitably, it has a knock-on effect on both of you.
They used to take the mickey out of me at the golf club. I'd already made an appointment with the doctors. I mentioned it to him and he said, well, I think we better try and sort something out there and put me on the tablets.
The tablets weren't going to be a long-term solution, and he certainly didn't want to be on tablets for...
No.
As time went on, he was getting more concerned about it.
Good. Benign prostate disease or benign prostatic enlargement, that is non-cancerous growth of the prostate, is almost inevitable in all men. Approximately 1 in 4 men experience BPH-related symptoms by age 55, with 90% of men over 70 symptomatic. This is much more common than prostate cancer. Symptoms may have a significant impact upon quality of life, and those symptoms include sleepless nights and urinary problems. It can cause loss of productivity, depression, and decreased quality of life.
We haven't done South America yet. Canada was very nice. The idea would go and see Niagara Falls. I had not been to the toilet properly since I got to Canada, and I realised that I might be taking the wrong tablets. So we went and tried to find a out-of-hours clinic, and they said, you've got to go to the hospital. There's nothing he could do. So then we went to the hospital, and by this time I'm getting myself...
You were getting in a bit of a state.
I was getting in a bit of a state.
We had to wait for quite a while.
Being the bladder full, they did get me through quite quickly. If you don't drain right out, there's always the chance of infection. They sorted me out with a catheter and said that you need to have that in for 4 days. I thought, oh dear, that's going to be just at the time we're supposed to be flying down to Washington. And I thought, well, I can't fly with this catheter. We decided to come home. That was a real turning point for me, and I thought that will change things.
Exceptionally upsetting for both of us. I think we were both in tears at one stage because we were so far away from home. It was just frightening, you know, the whole experience.
Medical therapy is primarily in the form of alpha blockers or another form of tablet called 5-alpha reductase inhibitors, and these look to relax the muscle in the prostate or shrink the prostate to try and improve symptoms. These tablets, however, inevitably are associated with certain side effects, not only such things such as headache and dizziness, but also potential effects upon sexual function, be it causing dry ejaculation or affecting libido, sex drive and erectile function itself. So there are many reasons then why men with symptoms which have started to affect their quality of life might think about other options other than conservative measures or indeed medication, and that's where surgery comes along.
When I did see Mr. Barber, he gave me these options, and I thought straight away that Urolift sounds good.
The arrival of this novel procedure represents a completely different opportunity to improve waterwork symptoms in a minimally invasive way, whilst preserving sexual function. Patients tend to see a very quick improvement in their symptoms. The post-operative symptoms of some burning when they pass urine, some blood in the urine, and perhaps some irritation of the waterworks tend to settle within a week. Occasionally they can take 2 weeks. Many men are back to normal activity in a number of days, and I would estimate that about 70% of men by then have got significant improvement in their waterworks.
All I can remember is being wheeled in, and then the next thing I've been waking up, and the nurse said, you can go home as soon as you've been to the toilet. I said, oh, I'll go now then, thank you very much. And I was back home here by 6 o'clock, so within 2 days, nothing, no sign of any sort of blood or anything, so more than pleased with that.
We can plan to do what we want to do with our holidays, so we can just go away and do everything that we really want to do while we still can.
Yeah, freedom at last. I'm really, really pleased with it.
Well, for both of us.
Well, it has, yes.
If anybody's sort of concerned about any of this, then just go for it, basically, because that's a great procedure to have.
Put a notice up at the golf club as well now. No tubes required.